Mr. Ahmed Salem to the stage to deliver the ZAP-X product presentation. Mr. Ahmed, the stage is yours.
So, Assalamu alaikum wa rahmatullahi wa barakatuh. My privileged guests, thank you for your time. Actually, I think my colleagues and my friends has already done a lot of information. Left me a few things to say, but I'm not going to take a lot of your time. I know that I'm standing now between you and the dinner, so I'm going to be brief. So, first of all, first we start, if you want to achieve new results, we need to have new methods. We need to have new platforms. We deserve to do more than good enough for our patients. We deserve to have our patients having a better quality of life, new options for treatments. For that, we need new platforms, new designs. So as you see, the ZAP-X is totally from scratch, a white page. It's not designed from as the normal linear accelerator to deliver clockwise or anti-clockwise, no. But we wanted to deliver the beam from anywhere, everywhere around the patients. So first of all, let me give you just a very quick glance about ZAP Surgical. So ZAP Surgical is a US company founded in 2014. I think that has been already been before by Erwan and Dr. Kukan. Founded by Professor John Adler. Professor John Adler is a neurosurgery professor emeritus in Stanford University. ZAP-X is a robot itself is designed to do a non-invasive skin and head and neck, and cancer, benign tumors, vascular disease, everything. So about the commercial adoption, we have now almost like 40 centers worldwide treating patients. We have more than 6,000 patients treated worldwide as we speak. ERCM, European Radiosurgery Center in Munich, has done like there are 1,000 patients in less than 4 years. And we have like 35 waiting to be installed projects in the near future. So why do we do what we do? Why do the world needs another radiosurgery machine? There is other platforms that are already doing well, already treating patients, delivering very high quality plans. Why do we need that? From the World Health Organization, there are 5 million patients, brain cancer patients, every year coming with diagnosed with brain cancer. Only 200,000 of them get radiosurgery treatment. Why? Because of the scarcity of the system, because of the complexity and the experiences needed to run these machines, which is not available everywhere. 96% of the patients does not receive their desired or the optimum treatment they should. So where did they go? They go either for open surgery or whole brain radiotherapy or palliative care, which is not their optimum treatment. So another field of patients, the unmet suffering need for patients, which are the behavioral disorder patients and functional disorder patients like addiction and obesity, chronic pain. And if you look on this side, we're talking about billions of dollars spent annually in order to treat these patients. And radiosurgery, we can deliver, we can provide them with better treatments. So how do we do that? We try to combine many new features, many technological advancements, unique technological features under one cover, which is ZAP Surgical. We put a dual gimbal, world's first dual gimbal linear accelerator, along with a continuous image guidance that preserves the sub-millimeter displacement or motion of the patient. At the same time, we will deliver the optimum dose. We know that brain is very sensitive to radiation, so the lower the dose, the better the quality of the treatment. In addition to which is a very unique feature, we measure a real-time dosimetry. Every beam enters the patient, the brain of the patient gets measured and evaluated and compared to the originally planned dose, so that to ensure that any malfunction, any error, anything happens with the system, it has to stop for the patient's safety. So combining this, we even more are trying to, or not trying, we have developed the world's first 3mm collimator, so that to treat the unmet and undiscovered treatments and undiscovered the indications of radiosurgery. As you see from the dosimetry on the right, 5mm millimeter dosimetry and dose distribution is totally different than 3mm. That's almost double the dose delivered to the healthy tissues, which is not used, which is not needed. So I think that the images speak for themselves. The image dosimetry on the left is totally different than the ZAP-X robotics surgery dose. That helps us for thalatomy, for instance. Thalatomy is a very straightforward indication that requires very precise dose, sub-millimeter accuracy, very precise and small area in the brain to have very high intensity radiation, radiosurgery dose, and to right beyond the tumor or beyond the lesion that we create, we need to have a very steep dose fall off, so that to preserve most of the healthy brain tissues and correct the functional disorders for the patients. So, and as you see, when lesioning and functional brain targets with SRS, more concentrated radiation, the sharper knife, theoretically the safer the procedure, which enables our patients to have better quality of life after that. As you see from the different radiosurgery platforms, we're talking about almost 3 times less the radio dose delivered to the patient. Again, when you compare with the geometry of the 5mm compared with the 4mm, and here you go, the steep dose fall off, the confinement of the radiation only in the tumor and preserving all the other. So that meets with our KPIs. Our KPIs is spreading all over, trying to be everywhere and anywhere, trying to break the rules of having a sophisticated high oncology or high edge technology for radiosurgery, which was always placed in either centers of excellency or academic hospitals or in the capitals. But most of the patients can't get access to these places because of several reasons, because of what we know that these places are always full of patients and waiting lists. So we have like 40 systems worldwide by end of 2025. We have reached 80 installation and ongoing projects to be installed. By the way, we started commercially delivering machines by almost half of 2020. We had the FDA license in 2017. We finished our clinical trials in 2019. COVID shut down the whole world for almost 1.5 years, from 19 to almost 2021. So we are talking about, we delivered 40 systems in 5 years, in addition to more than 35 orders and projects awaiting to be, which gives an sense about the adoption of this technology and about how fast clinicians worldwide are adopting these technologies. Global patients, if you see from the slide, April 2023, we had 1,000 patients treated, and within less than 3 years, we treated almost double the size or triple the size. We reached like 5,000 patients by August 2025. Year to date, we don't have yet the numbers, but I know that we have exceeded 1,000 patients treated worldwide. High throughput example, for instance, we had Dr. Gukan. They are treating almost 10 patients every day. Some days they treat like 15 patients a day. And there are no boundaries for a maximum patient number per day, no boundaries for the usage of the machine. It's not about a COBOL-based system, it's a Linux-based system. You can switch it on and off anywhere, anytime, which gives you full flexibility of treating your patients. Then the patient demography, the patient divisions. Almost 52 of our patients are malignant tumors. mine and vascular and functional, others are almost like a 20%. The rest are benign tumors. So a little bit about economies here, because what we want to do is trying to change the paradigm of radiosurgery worldwide to get out of the center of excellence, as I said, and academic cities, academic universities or hospitals or places that need high clinical expertise to be everywhere, to be everywhere. You've seen some of our sites in Utsunomiya, for instance, in Japan. It's in a train station, bullet train station. Some of our other sites, it's in the car parking area. We don't have to be inside a hospital in order to have a radiosurgery and a high-tech radiosurgery center. So if you look at these numbers, we saved the budget, the hospital's budget, almost $1 million, which is the cost of the bunker. We saved the hospital around $100,000 more about for safety and hand scanners whatsoever. I don't want to go through all of these numbers because it varies from country to country, but this gives you an sense and a figures about what is saved in 10 years project timeline. We are talking about $4 million, almost plus and minus, depending on the country's ins and outs. But $4 million, that's another linear accelerator, that's another equipment, that's another expansion for your hospital. That's another patient program meant to be introduced within your facility that expands your services. Again, we've seen this before, but this is our installation base. As Professor Adler mentioned in his presentation, we are almost everywhere now. We got all the license worldwide, the Shonin, the MDA, the FDA, of course, of US, mark. We are having projects in Northern Africa very, very soon, in Algeria and Morocco, soon in Egypt as well. In Asia, in India, we had two centers in Apollo and in AIG. I'm talking about the nearest lab centers to you, of course, along with Japan. So in five years of commercial activity, I think we have almost reached everywhere worldwide. Reimagining radiosurgery, yes, of course. We don't have any limitations to install the machine anywhere. It depends on the place. We have a minimum space, of course, but if you want to put it on the ground, if you want to put it on a garden area, if you want to put it in even a trailer, one of our centers' space wasn't ready, and they didn't want to interrupt their patient treatment, so they asked us to put it in a trailer. 7 months after, we shifted the machine from the trailer to the designated place. So again, we don't have any boundaries in order to preserve patients' required services. I think we have seen this before. This is our state-of-art showcase in Taiwan, our recent ZAP-X systems, Kaohsiung Hospital in Taiwan. As you see, it's a very, but I wouldn't say that they have saved budget here, because this center is very, very elegant one, and they wanted to showcase the center, and they wanted to showcase the ZAP-X system in the hospital. So again, some bases. This is Hackensack Meridian. Okay, PRCM, one of the most famous centers have for ZAP-X. Professor Alexander Malsevich used to do gamma knife and then cyber knife for almost like 20 years. And now he's got not now actually, he started like 4 years back treating with ZAP-X. So he's got the cyber knife, 2 cyber knives and a ZAP-X in his center, treating patients and bring patients surgery platforms depending on the indication, which gives an sense that there is no competition there. It's not about competition, more or less than what indication is better placed in which platform, so that to provide your patient with the best treatment options. Hacettepe University, I think Dr. Gukan has mentioned. Okay, and Neurospine Center, that's a bullet train station. Okay, why ZAP-X? I don't want to take much of your time, but I think we have come through the ultra-local emission leakage. It's very sharp, the sharpest penumbra in the radiation oncology or radiation therapy industry worldwide. SRS optimized. It's a differentiating technology. Wherever it is placed, it really gives the marketing tool even for the hospital, gives the sense of technological advancements of the hospital and high quality service for your patients. No source decay. You don't have to bother yourself with additional costs that you can save. You can put your budget, put your costs, put your investments, future expenditure on the right place rather than maintaining the existing equipment. And that's for our divers, our new technology. Sometimes our engineers get a little bit excited, so anywhere, everywhere. Can comment. Thank you. Any questions, please?